Today I'm with Dr. Gary Watts. He's an orthopedic surgeon who specializes in hand surgery. He's a graduate of the Oklahoma College of Medicine and has his own independent practice here in Tulsa, Oklahoma. Doctor, would you explain to the students just how you first became interested in medicine and talk a little bit about your specialty?
Absolutely. Let me go back, Bill, to my early history. I grew up in Oklahoma City. I attended public schools, small neighborhood grade school, followed by a neighborhood high school. They were excellent public schools where I enjoyed science and math when I was in high school. My father was a military man, a veteran of World War II, and encouraged military training, which for me meant going to New Mexico Military Institute in Roswell, New Mexico. Actually, I made a deal with him that if I made good grades, he'd buy me a car, and that was good incentive. I did go to New Mexico Military Institute for 2 years as a junior college, and the military discipline was actually very good for me. It yielded academic achievement, which propelled me through my college years. I transferred to the University of Oklahoma, where I entered engineering school. My reason for doing that was that I had been strong in science and math. I enjoyed that area and thought that would lead naturally to engineering. I completed a degree in civil engineering, and at that time in the mid-70s, the oil companies were hiring. There was an oil boom, so I went to work for Amoco Production Company as an engineer for the princely sum of about $1,000 a month, and I was happy with that. It was an excellent company. Engineering is a great field. It's right for a lot of people, but for me, the type of work didn't have the human interest that I was yearning for. There was another engineer who worked at Amoco who had wanted to go to medical school all along, and as I talked to him, I realized that I had a passion for working with people and for helping people, and I chose to go back, pick up some credits, and study the medical sciences so that I could work with people. I did that. I enrolled in the University of Oklahoma, went through their admissions process, and started medical school in the late 70s. Medical school is 4 years of training, typically after college. Sometimes college can be abbreviated in order to pick up the credits, usually about 60 to 90 hours that are required for med school, but most people complete a college degree. While I was in medical school and as I progressed, we rotated through various areas, and I was fascinated by orthopedics, which is a medical and surgical specialty dealing with the musculoskeletal system. This includes athletic injuries and surgery. The thing that appealed to me about that was that it was an endeavor that treated patients of all ages and returned patients to functional or athletic pursuits as opposed to just dealing with people who had chronic illnesses, and I found that to be fascinating. So I pursued a training field, a residency in orthopedic surgery, which is a 5-year residency after medical school. There are a number of programs in the country, and I applied to one in Kansas and went there for 5 years of orthopedic residency, during which I learned to treat injuries, conditions, and diseases of the musculoskeletal system.
Now, is that done in a hospital? Is that residency usually in a hospital, or what kind of setting is that usually?
It is usually affiliated with a hospital. It can be a university hospital, such as the University of Oklahoma Hospital Complex in Oklahoma City or the OSU Complex in Tulsa. It is typically a hospital-affiliated program, usually university-based, sometimes private. So the first 2 years of medical school are typically didactic, spent in the classroom for the most part, but progressively with more time spent in clinical settings. And eventually the last 2 years of medical school are spent in the hospitals, rotating through various areas such as internal medicine, pediatrics, surgery, and so forth. While I was in my 5-year orthopedic residency, we rotated through various subspecialties, one of which was hand surgery. That was an original subspecialty of orthopedics. It came about shortly after World War II when there were numerous veterans and others with hand injuries that needed to be treated, and there weren't many people who had expertise in hand surgery. So there was a very brilliant hand surgeon from San Francisco, a Dr. Sterling Bennell, who knew a lot about hand surgery, and he set up a series of centers and trained hand surgeons. And now, 50, 60 years later, we have a number of hand surgeons in the country. That was what interested me, the intricacy of it, the complexity of it, and just everything about it. There are other subspecialties of orthopedics, such as joint replacement, sports medicine, spine surgery, children's orthopedics, etc. I completed the 5-year residency in orthopedic surgery and then did a 1-year fellowship in hand surgery at the University of Tennessee in the Campbell Clinic, which is a well-known orthopedic training program. I then went back to Kansas to practice for several years, but that wasn't my home or where my roots were, so I moved back to Oklahoma and ultimately Tulsa, Oklahoma, which is a wonderful community, and I joined a large group practice here. Within several years, I knew that I wanted to go into private practice because that offers a degree of autonomy that larger practices don't, and that's something that always appealed to me. So now, nearly 30 years later, I'm in the private practice of orthopedic surgery with hand surgery as my subspecialty. I have a clinic that's on the campus of St. Francis South Hospital in Tulsa. I see patients in clinic 3 days weekly, typically 25 to 30 patients in clinic each of those days. 2 days a week I have surgery, during which I will do 5 to 6 cases, surgical cases, and these are typically involving the hand or the arm because that's my subspecialty, and it might range from a case involving a fracture that needs treatment or some type of reconstructive joint surgery or a nerve surgery. Many different kinds of cases are performed in the course of a hand surgical practice. In terms of graduating medical students and residents nowadays, there are many areas of expertise and specialty, including internal medicine, pediatrics, family practice, and the surgical specialties such as general surgery, orthopedic surgery, urologic surgery, etc. Nowadays, most doctors are employed by groups such as hospital groups or group practices of physicians rather than going into independent practice as I have. That represents the landscape of medicine currently. And the reasons for that are that there is strength in numbers, and the larger practices have the ability to deal with the changing times, the insurance picture, and the requirements of medical practice nowadays. So most graduating residents go into an employment situation.
Mm-hmm.
In terms of advice for high school students, I have these points that I'd like to make. First of all, try to develop good study habits. Set aside a time every night, typically 2 hours in length. Turn off all media, TV, cell phones, computers, unless you're using the computers directly in your study. Turn those off. Those are distracting influences. Keep a log of your work. Take notes so that you can refer back to those to help jog your memory about what you've studied and what you've learned. Try to study ahead and not cram at the last minute for exams. I encourage you to diversify your education. Have a well-rounded approach to your education. If you're strong in math and science, that's great. We need more people who have those skills. But try also to include humanities Include the arts. Find an area of the arts where you have interest and talent, be that music, dance, or the performing arts. Also include sports in your diversification. Find something that you can do that's physical, because that helps develop your body, and the sports activities and the athletic activities improve the development of your brain and your intellect. Another bit of advice is to read independently. That strengthens the mind. Books, especially those about history and biographies of accomplished people, are very helpful and can give you good ideas about where your interest lies. Socialize. Having a healthy social contact or group of contacts is very important to developing a sense of yourself and your purpose and where you want to go. Learn to write. Put your thoughts down on paper. This teaches clear, concise thinking and will help you in later endeavors. Learn to speak. Learn to communicate your thoughts and ideas verbally. That helps you in any endeavor that you go into, be it a science-related endeavor or any other kind. Finally, find your passion. Look for what really interests and motivates you, and make a decision, make a conscious decision to pursue this passion. When you do that, when you make a decision to pursue your passion, you'll make a series of smaller decisions and choices that propel you in that direction and ultimately help you achieve your goals and guide you in that direction.
Dr. Watts, would you talk a little bit more about the kind of hours that are involved in your practice? I know you work not just during the week, but you're on call and there's a lot of demands on your time.
You bet. Medicine is a practice of commitment to taking care of people, and it requires long hours, oftentimes including being on call. Being on call involves being available to respond to the emergency room, for example, or to hospital duties that might be after hours or even in the middle of the night. It's part of a training program such as a residency or a fellowship, and it's part of a mature practice once the resident is out in his medical practice. Typically, in practice, we take call anywhere from 3 to 7 nights or days per month, and that involves being available should the emergency room or other doctors call you and need your expertise. So that really summarizes being on call. Now, in the office, we try to keep more regular hours. Typically, we'll start at about 8 o'clock. We'll go till 5 or 6 o'clock. I'll see patients in the office, typically 25 to 30 or more patients per day, oftentimes working patients into the schedule who have urgent situations or perhaps emergencies. Sometimes in the evening after clinic, I'll have to do a surgery on a patient who has an emergency, even if I'm not on call.
And one of the things that I think's interesting to most people is the business aspects of being a physician in today's environment. I think it's only a recent thing where physicians have been actually salaried. Can you talk a little bit about that and some of the financial issues that physicians have to deal with now in this environment?
Certainly. Medical school, for me, really didn't prepare me for the business side of medical practice. Hopefully that has changed, but my advice to you is to take one or several business courses along the way, study that part of our society and become familiar with it independently from your medical training if you can. I think it's very important for physicians to understand the business side of medicine. You can't expect to get rich practicing medicine. You'll have a good salary, You'll be able to support your family. You'll have a comfortable living, but don't expect to get rich. Expect to be compensated for your services, but if the acquisition of money and wealth is your desire, then medicine is not the right choice for you. You can build your wealth, build your estate through other means, through investments, through business practices, but to go into medicine, you should have a passion for it, and you should be motivated more by helping people than making money. And that's also true of what specialty you choose. You should choose a specialty that appeals to you in terms of what you're going to do and how you're going to spend your time rather than the money that you would make from it.
Is there anything else you'd like to pass on to students that you've learned with all your years of experience?
Remember the principles that I mentioned about how to study, how to diversify your education, how to read, be able to express your thoughts vocally and in writing. Try to develop a well-rounded course of study. Don't narrow yourself too much right away. And realize that it's okay to change your path. If you believe that you should do something or you should pursue a particular career and that doesn't seem to be going well for you, don't hesitate to make a mid-course correction. Don't hesitate to change your focus and follow your passion. Ultimately, I think that will be the most satisfying thing that you can do.
If you have an interest in talking to Dr. Watts about careers in medicine, just go to our online career question and answer page and sign up. We'll contact you as soon as those sessions are scheduled.